The priority list for who should receive the vaccine is decided by the Joint Committee on Vaccination and Immunisation. We can speak now to the Deputy Chair, Dr. Anthony Harnden. Good morning. Thank you for being with us this morning. Just to pick up, it's probably good to start with those new vaccine hubs. How important are they and the others around the country that are going to be vaccinating, hopefully, millions of people over the next few weeks?
Well, this is a monumental national effort, Dan, and you know, increasing capacity is obviously clearly a fantastic plan. Many immunisations, particularly in the elderly, have been delivered through primary care, and the primary care teams have worked tirelessly throughout the country delivering these. But of course, as the population get younger that we vaccinate, as we go down the age bands, they get more mobile, and therefore mass vaccination centres will be really welcome. The other issue, of course, is that everybody will need a second dose eventually after 12 weeks. And at the time that we'll be giving the second dose, we'll still be giving the first dose to some people, and therefore we'll need more capacity. So yes, I mean, I think, to use a football analogy, Dan, what we want to see is lots of Premier League vaccination teams throughout the country, and there certainly are that at the moment.
OK, I think that for any football fans out there, that'll probably help. We're getting an awful lot of questions about, I'm sure you can appreciate this, you touched on it a little bit there, people in their 80s in various parts of the country who haven't yet received their vaccine, or those family members of those who haven't yet received their vaccine, worried now about those 70 and upwards who are going to get some letters this week. Why are there different parts of the country that are managing to get through that sort of part of the population quicker than others? What's happening?
Well, we clearly on JCVI have listed 4 top priority groups: care home residents and their staff, and the over 80s and the clinically vulnerable. And we do expect teams to be targeting those in the first instance. There is bound to be variation throughout the country. That's inevitable, depending on the setup locally, and we understood that on JCVI. But our strong steer from the JCVI perspective is to get those 2 top groups immunised as quickly as possible, and then move further down the list. The Prime Minister's made a commitment that the first 4 top groups will be immunised by mid-February, and clearly if vaccination teams are doing extremely well in local areas, then it's not unreasonable to move towards priority groups 3 and 4. But really our focus throughout the country should still be on making sure that those over 80s and those care home residents and those frontline healthcare workers and the staff, social staff, get immunised. This is really important because 88% approximately of the deaths occur in those first 4 deaths and hospitalisations occur in those first 4 priority groups. And if we are to relieve pressure on the NHS, which is really at breaking point at the moment, we need to get those top 4 groups immunised as quickly as possible. And the elderly, the more elderly you are, the more risk you are of hospitalisation through coronavirus. And therefore, it is imperative that those in the very older age groups are immunised now.
We spoke to the Vaccines Minister, Nadhim Zahawi, about 45 minutes ago, and he, like you, was confident of reaching those targets. The one area of concern he seemed to have was that of supply. Do you share those concerns? Are you worried about the supply coming into the UK, or do you think that will meet the number of vaccinations we need to do?
Well, it's clearly difficult. I'm not responsible for supply, but I understand the government have ordered 100 million AstraZeneca vaccines and 40 million Pfizer vaccines. Manufacturers are working around the clock, but this is a massive manufacturing exercise, a scale we've never seen in vaccines before. And so, you know, we are leading the world at this at the moment. And I think that, you know, it will come good with time, but there are bound to be teething issues. So I think the fact that the ministers have given a commitment to mid-February must mean that they are confident that we will get enough supply. And so we on JCVI are hoping that will be the case.
We also spoke to him about the priority list once those first 4 cohorts have been vaccinated by mid-February. Where are we up to with that? Because I know that is part of your remit, isn't it, about whether it's teachers or police officers who will be on that priority list. Where can you tell us about that this morning?
Well, as you know, Dan, we created 9 first priority lists, which went down to the age of 50, and that accounted for 99% of hospitalisations and deaths. We will, over the next few weeks, be looking at phase 2 of the programme, which will look at wider issues. It will still look at disease, hospitalisation and death risk, but it will look at other things like exposure risk, key workers, and trying to keep the country running. And obviously teachers, policemen that haven't fallen into the over 50 categories or those with underlying illness will be high up on the agenda, and we will be discussing which groups to target the next phase 2 of the vaccine.
Okay. Have the government given you a deadline on that? Have you given yourself a deadline? I know you said the next few weeks, but I'm asking you that just because we are getting so many requests from people, not only in those groups, but to know exactly what the sort of plan will be once those first 4 cohorts have been done, hopefully by mid-February.
No, I can't give you a deadline. I'd like to re-emphasise that JCVI's advice at the moment is that we go through all 9 cohorts, but there will be an overlap, that I'm sure. And so public ought to be absolutely rest assured that we will get to them as quickly as possible, and we will come up with what is a fair and proper prioritisation list to try and get us out of this mess. Vaccination is the only way out of this coronavirus epidemic, and it is our intention that we have everybody in the population is offered an immunisation. The key thing, Dan, is for people when they are offered it to take it up. It's really, really important that we get high coverage of this vaccination. There are people that don't have as much confidence, and it's up to us to try and persuade them that they're both effective, safe, and it is the way out of this pandemic. So rest assured, people will be offered the vaccine.
Dr. Anthony Harnden, thank you very much for your time this morning. Good to talk to you.